Traditionally, medical care has always been in a building and you expect your patient to come to you. It assumes that you have a phone that you can call for an appointment. It assumes you have a car that you can get to places. It assumes you can advocate for yourself and that you can keep track of your schedule. And when you're on the streets and you're struggling, you don't have any of that.
When somebody's camping, it's a hassle for them to bring all their belongings with them.
So meeting people where they're at, I don't have to talk about someone's high blood pressure in these four walls.
Being where people stay is critical to our care model. This is why we do what we do, so we can bring you this care that you don't even know that you might need. I oversee the homeless services within CommUnityCare, and that includes our clinic at the Arch, our street medicine team, our mobile team, which goes to fixed sites like Community First Village, Camp Esperanza, Sunrise, and then what we call our homeless healthcare hub, which is Care Connections Clinic.
Hey, David, how are you?
What is so special about the Arch team is during the pandemic, everything was so shut down. It was really this Arch team that really helped keep downtown safe.
How are your joints doing lately? We do everything that we can to meet the primary care needs of the people around this area. And so that could be from blood pressure to diabetes to stitching up a wound.
There's some patients here that just want socks, hygiene packs.
Preventative care, like a pap smear or getting a mammogram ordered, COVID vaccines.
We just try to take care of them as much as possible, like they're whole, because they've been through a lot.
Yeah, it's almost back to normal. David and I have gotten to know each other very well. Often he comes in, sometimes for medical visits, sometimes he just needs to get away from things, and he knows it's a safe place, and that's a big part of health, right? Feeling safe.
I have confidants, somebody I can trust. It's not just the knowledge of medicine. It's more like a friendship and family.
Healthcare is not just the physical health, it's all of it. It's your social well-being, it's your mental health, and all these other things that you deal with in your life that's going to affect you being able to take care of yourself.
We're just a piece in the puzzle for them to get stability, and if housing is their option to get their goal to get housed.
I'm already waiting to be housed already. I'm just, everything's set. I would have never had this chance if it wouldn't have been for my doctors to start this process. So I want to get better enough, and I've been accomplishing that. And I couldn't have done it without the CommUnityCare here in the Arch, and the staff here, the doctors. I couldn't have done it without them.
It makes sense that we are where the people are, and so if people are staying downtown, we'll go downtown. If people are over at Arch, at Sunrise, we'll go there. And there's now a big population at Camp Esperanza, and we'll go there. Okay, so then I do need to get a little bit of information from you, if that's okay.
When Tu first came out to the Esperanza community, the first thing we did was a needs assessment interview.
Is it very painful?
Consistently in the top couple of things that pretty much everybody cited was medical care. The barriers that people have accessing medical care are the same barriers that they're having accessing employment, and the same barriers that they're having accessing housing.
So what I'm going to do is I'm going to clean it out. I think what I love about being out here is just making it easy for people who've never had great access to healthcare. So how long ago did it start?
I think it's either between Thursday and Friday.
He's a great example of someone who hasn't really seen a doctor for a long time. Came in because of a wound, but you did a really good job. And then while he was here, got some blood work done to check him for diabetes. We're able to also get a vision voucher for him so he can get a pair of glasses.
I mean, they did it real quick, and the doctor was totally awesome with me. If I get sick or something happens, I'll be here.
In medicine, there's acute things like a cut or a wound, and then there's something called health maintenance, which is things that would be good to do for prevention. Those things fall by the wayside when you're homeless. Like you barely can keep up with your day-to-day, let alone like things that are preventative.
I was having some serious health problems that I needed to address. I was in a workers' dorm because I was working for Habitat for Humanity at the time, but I couldn't afford to get my own place.
When they had an outbreak of COVID, he was sent over to the ProLodges. These ProLodges were created, to really take these highest risk individuals and keep them safe.
While I was in the ProLodge, Community Care was knocking on my door, checking to see if I was okay, calling me on the phone to see if I was okay. I started getting this weird pain in my abdominal area.
We were like, hey, you're in a safe place, we should do a colonoscopy, like, because it's really hard to do a colonoscopy when you're homeless.
They removed 4 polyps, and 2 of them were like almost the size of a dime, but one of them was cancerous. And I was informed within a day that I had cancer.
And so oftentimes when you do have cancer and you're on the streets, treatment is not an option until we can get you housed, and that'll take months.
She immediately basically connected me with an oncologist. Before I knew it, I had surgery.
It's night and day between someone who's housed and not, that he could get diagnosed, get all the workup, get treatment, and now he is in remission.
I am not showing any symptom. The abdominal pains that I was having are gone.
And that is insane. It's great. It's so great.
I strongly believe that the ProLodge basically helped save my life in a way, and combined with community care help.
It just, I think, underscores like how much housing is connected to your health. And you can't really do one without the other.
To be with them at the beginning of their journey all the way up till they get housed is amazing.
I always say we see the hardest of the hard, but we also get to see the best of the best.
I can only thank, Community Care and Dr. Kwong. Dr. Kwong to me is God.
As a provider who feels so frustrated by the things I can't do, to see that happen it gives me hope, and it makes me want to keep fighting for housing.